I mean, genetics in cancer is really the name of the game. So, the last chapter in the book called The Future of Cancer Care,
Mm,
I talk about various aspects where I think the future of cancer care will be a bit different, including the use of genomics and genetics when it comes to diagnosing cancer and treating cancer. Today, the ability to understand cancer on the molecular level has transformed how we actually target and treat cancer and how we really even think of cancer. So think of the cancer as a building. That's all what we knew about the cancer. It's a building, and we just need to actually destroy that building. So we just throw rocks at it, and these rocks are various types of chemotherapies and so on. Well, today we know the details of inside the building. We know the rooms of the building. We know the detail of every room. So you have the details of what's happening inside. So instead of just throwing rocks at it, and because when you throw rocks at a building and the building destroys, you have a lot of collateral damage because everything's going to be destroyed. Well, now you actually become more methodical into how you attack that building. So, well, I'm just go in. The problem in this building is not the whole building. Maybe there's like, this one room that is really to take care of it and so on. So that's how I view genomes in cancer. Right now, we have the technology of actually sequencing tumors and understanding the DNA architecture, the RNA architecture, the protein architecture of these tumors. And once you actually know that, number one, develop drugs that target these. Number two, if you already have drugs that can target these, you can use these drugs. Why use the rocks if you can use a very more targeted treatment that doesn't cause a lot of damage to healthy people and healthy tissue?